What is the reason for my horrible puffy eyes and dark circles? I am really desperate with these huge puffy eyes and dark circles, and I am just 30 years old. I shave basically every morning to go to the office, and I know what people think. This guy must have partied all night. Is a plastic surgery the only help, or could it be another reason, allergic, etc.? It doesn't matter if I drink or sleep not enough. It is always the same. I would say it gets better during the day, but it will stay at least until late afternoon. I would highly appreciate advice.
Thank you for your question. Your question was described very well your feelings about having bags under your eyes, and the photos you submitted are very helpful. Certainly at 30 years old, it is understandable that you feel that many people are perceiving you in a way that is not accurate. In fact, as a practicing cosmetic oculofacial plastic surgeon for 20 years and having written a book, The Fine Art of Looking Younger, I can certainly share with you that, first of all, a lot of young males have similar problems with puffiness under the eyes, and I've had patients who actually stopped looking in mirrors because they were always bothered by how much the puffiness under their eyes made them look so tired. And there is a lot about the micro expressions or how our appearance communicates who we are, how we feel, and the energy level. And certainly bags under the eyes often is perceived as someone who is not sleeping enough, is partying too much, and all that other stuff. So I'll let you know a little bit about what our approach is in our practice and help you also understand what it is that you're dealing with. So let's talk a little bit about the anatomy. The lower eyelid puffiness that's always persistent and appears from the photos that you submitted to be something called lower eyelid fat prolapse. Now, lower eyelid fat prolapse has nothing to do with body fat. It is a genetic tendency for fat that is normally around the eyes to push forward and create a bulge. And because it's a physical volume, topical treatments such as creams or ice or other things that people do, cucumber slices, tea bags, those things don't work. In our practice, for a young male who doesn't have extra skin, we usually do a procedure called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty is a method of addressing the fat pockets by reducing and repositioning them from the inside of the eyelid. This way, no external scar is seen, and the shape, the intrinsic natural shape of the eye is retained. In fact, our patients feel like they look younger, their face looks brighter, and there's no way someone looking at them could ever tell that they had surgery. And that's the idea. You want it to look as natural as possible. I always caution my male patients also that unlike women who routinely wear makeup, men are just not comfortable with doing any kind of cover-up. And so avoiding an external incision, that's the point of the statement, is that by avoiding external incision, you don't have anything to really cover up. You may get a little bit of bruising, a little yellow discoloration for about a week or so, but that's basically it. Most of our patients also, we focus a lot on quick recovery. So we do the procedure under local anesthesia with light IV sedation. So I think that is probably the way to go, is to meet with cosmetic surgeons and look for someone who has a lot of experience with this type of surgery. I'd also mention to you that it is routine in our practice that we use something called platelet-rich plasma. The platelet-rich plasma is derived from your own blood and has many growth factors that help improve skin quality and is very often a great combination with our lower eyelid blepharoplasty or transconjunctival blepharoplasty. So at this point, I think that you're clearly very, very motivated meet with cosmetic surgeons, do a lot of research, and find a doctor that you click with and trust. I would encourage you to have the procedure, as I said, under local anesthesia with sedation. I feel like it's the best way to get a quicker recovery. But once you meet with a doctor that clicks with you, move forward, and I think you will have a great weight taken off of your mind by having the puffiness under the eyes reduced. Some of our happiest patients are people who have had this procedure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.